I think we're going to have outbreaks here in the U.S. We need to start preparing for that. That doesn't mean we're going to have an epidemic here, but to avert an epidemic, we need to do better diagnostic screening.
Not vaccines. Yeah.
And right now, the diagnostic test we have requires samples to be sent off. It takes a number of days to get a positive result back. What you really need is a point-of-care diagnostic that allows you to screen people out quickly, and if people, have presumptive infection, isolate them. I think that we can control an epidemic here in the U.S. if we take the right steps in terms of how we address the outbreaks that are inevitable. I think China
outbreaks are inevitable here.
I think we should be conditioning to expect some limited outbreaks. That doesn't mean they need to be large, but we're going to have some sustained spread in certain small pockets here because there's a sufficient number of cases ex-U.S. Some of it's going to get imported. The problem is we don't know what they're really looking at. I think the Chinese haven't been forthcoming with information, so we've been patting them on the back for being good actors in this case because they're behaving better than they did with SARS. They're still not behaving well. They've concealed key information, including that this was spreading to healthcare workers, which they didn't admit to last week. So we don't really know the full scope of what they're facing. I suppose that they're facing a very large epidemic and they're taking pretty draconian measures. Some of these are not going to work. The quarantines might not be effective.